Today, we're diving into the rugged and often terrifying world of Old West medicine. Imagine living in a time when a simple injury could be a death sentence. Let's explore how doctors in the Wild West treated some of the most deadly injuries and illnesses of their time. Number 1. The harsh reality of medical care. In the Old West, medical care was rudimentary and often dangerous. Due to the scarcity of trained professionals and medical supplies, treatments were frequently improvised. Medical practitioners were a mix of formally trained doctors and self-taught individuals. Many doctors had little or no formal education, and it wasn't uncommon for anyone with a bit of knowledge to call themselves a doctor. The lack of regulation meant that treatments varied widely and were often based on outdated medical theories. For example, bloodletting was a common practice, where doctors believed that removing blood could cure or prevent illnesses. However, this practice often led to severe blood loss and weakened patients further. Leeches were frequently used for this purpose, despite the high risk of infection and complications. Surgical procedures were perilous due to the absence of proper sterilization techniques. Tools were rarely cleaned between uses, leading to high infection rates. Anesthesia was primitive. Patients undergoing surgery might be given whiskey or opium, but often they had to endure the pain with minimal relief. In desperate cases, doctors resorted to amputations to prevent the spread of infection, but the lack of antiseptics made these procedures incredibly risky. Doctors in the Old West had to contend with a wide range of injuries and diseases, from gunshot wounds to epidemics of cholera and smallpox. Quarantine measures were primitive, and treatments were often based on trial and error, leading to high mortality rates. The harsh reality of medical care in the Old West highlights the significant advancements in medical science and the importance of proper training and regulation in the field. Number 2. Bloodletting and leeches. Bloodletting, a prevalent medical treatment in the Old West, was based on the belief that many illnesses were caused by an excess of blood or other bodily fluids. Doctors would often use leeches to perform this procedure, attaching them to patients to draw blood. This practice was thought to balance the body's humors and restore health. Leeches were preferred because they could remove a significant amount of blood without requiring a more invasive procedure. However, this method was fraught with risks. Patients frequently suffered from severe blood loss, which could weaken them further and sometimes lead to death. The lack of understanding of infection control exacerbated these dangers, as the wounds created by leeches could easily become infected, especially in the unsanitary conditions of the frontier. Despite its widespread use, bloodletting was not based on scientific evidence. It was a holdover from ancient medical theories that persisted into the 19th century. The method often did more harm than good, but in an era with limited medical knowledge and few alternatives, it remained a go-to treatment for many ailments. Additionally, the use of leeches extended beyond human medicine. They were also employed in veterinary practices, demonstrating the widespread acceptance of this technique despite its dubious efficacy. Number 3. Pain management. Pain management in the Old West was a harrowing ordeal due to the lack of modern anesthesia. Patients undergoing surgery or dealing with severe injuries had limited options for pain relief. Whiskey was one of the most commonly used substances to numb the pain. Patients would be given large quantities to drink before procedures, hoping it would provide some level of sedation and reduce their awareness of the pain. Opium was another widely used painkiller. Doctors often administered laudanum, a tincture of opium, to help patients endure the agony of surgeries and serious injuries. However, the dosages were not well regulated, leading to potential overdoses and addiction. In the absence of these substances, patients were sometimes given leather straps or wooden sticks to bite down on during excruciating procedures. This was intended to prevent them from biting their tongues or screaming out in pain. The tools available for surgery were rudimentary, and the conditions were far from sterile. This meant that even minor surgeries could result in severe pain and high risk of infection. Without proper sanitation, complications were common, and the pain management methods available did little to alleviate the suffering associated with these conditions. Beyond chemical aids, some practitioners turned to hypnotism and other psychological techniques, although these were less common and often viewed with skepticism. The harsh realities of pain management in the Old West underscore the brutal conditions faced by patients and the desperate measures taken by doctors to provide relief. Number 4. Bullet wounds and amputations. Gunshot wounds were a frequent and severe issue in the Wild West, leading to dire medical challenges. The lack of modern surgical techniques and sterile environments meant infections were common and often deadly. Doctors had to make quick decisions, and amputation was a common solution to prevent the spread of infection from a wound that might otherwise be fatal. Amputations were carried out with basic tools such as saws and knives, which were often not sterilized. The use of carbolic acid or whiskey for cleaning wounds and instruments was primitive and insufficient, leading to high rates of post-operative infection. The operating table could be anything from a makeshift wooden plank to a kitchen table, adding to the risk of contamination. Without antiseptics, the risk of gangrene was high. Gangrene, caused by bacterial infection, could spread rapidly, leaving doctors with no choice but to amputate the affected limb. This procedure was extremely painful, as effective anesthesia was not available. Patients might be given opium or alcohol to dull the pain, but these were hardly sufficient for the trauma of amputation. The psychological impact on patients was also severe. Many who underwent amputations faced not only physical pain, but also the challenge of adapting to life with a disability in a harsh and unforgiving environment. The societal and personal consequences of these medical interventions were profound, affecting not just the physical health, but also the mental well-being of the injured. Number 5. Snake bites. Snake bites were a significant threat in the Old West due to the prevalence of venomous species like rattlesnakes. The primary method of treatment often involved cutting open the wound and attempting to suck out the venom, a practice rooted more in folklore than medical efficacy. This method, while popular, was largely ineffective and could sometimes worsen the situation by introducing infections. Another common approach was the application of poultices made from various herbs. These poultices were believed to draw out the venom and provide relief. Ingredients for these poultices varied widely and could include anything from tobacco and onions to plantain leaves and mud. While some of these treatments had minor antiseptic properties, they were generally not potent enough to neutralize the venom. In some cases, frontier doctors resorted to cauterizing the bite wound with a hot iron or applying ice to slow the spread of venom. These methods were painful and often did little to improve the patient's chances of survival. The lack of antivenom and proper medical knowledge made snake bites a particularly deadly hazard. Victims frequently succumbed to the venom's effects, which could include severe swelling, tissue necrosis, and systemic symptoms like nausea, vomiting, and paralysis. Additionally, some treatments included the use of alcohol to soothe the patient or as a disinfectant, though this was more about managing pain than treating the venom. The overall success rate of these methods was low, leading to high mortality rates from snake bites. Number 6. Improvised treatments. Improvised medical treatments in the Old West were a testament to the creativity and desperation of frontier doctors. With limited access to proper medical supplies, doctors often turned to whatever was available. Carbolic acid, for instance, was frequently used to sterilize wounds despite its harshness and potential to cause burns. Whiskey served a dual purpose. It was both a disinfectant for wounds and an anesthetic to numb pain. To treat fevers, doctors sometimes resorted to drastic measures like placing patients in cold water baths. This method was based on the idea that lowering body temperature could help reduce fever, though it often resulted in shock or hypothermia. Pain management was another area where improvisation was common. Morphine and cocaine were administered for their analgesic properties, but dosages were haphazard and often led to addiction. Morphine was especially valued for its ability to provide significant pain relief, while cocaine was sometimes used to numb specific areas, though its addictive potential was not well understood at the time. Some treatments were even more unconventional. Poultices made from a variety of ingredients like bread, milk, or herbs were applied to wounds and infections in the hope of drawing out toxins. Mustard plasters, made by mixing mustard powder with flour and water, were used to relieve respiratory issues and muscle pain, despite causing skin irritation and burns. Number 7. Childbirth. Childbirth in the Old West posed severe risks due to the lack of advanced medical knowledge and sanitary practices. Midwives were often the primary caregivers during childbirth, stepping in to assist mothers with minimal formal training. These women relied on traditional knowledge and experience, but without access to sterile environments or modern medical equipment, complications were common and frequently led to fatalities. One major issue was the prevalence of puerperal fever, a bacterial infection that could spread rapidly due to unclean hands and instruments. Without understanding germ theory, midwives and doctors did not practice proper sanitation, which increased the risk of infection. Additionally, breech births, where the baby is positioned feet first, and other complications like prolonged labor or hemorrhage were challenging to manage. The absence of surgical options, such as cesarean sections, meant that any serious complication could end tragically for both mother and child. The use of makeshift tools and reliance on herbal remedies could provide some relief but often fell short in critical situations. Pain management during childbirth was another significant challenge. Women were typically given minimal pain relief, which could include alcohol or opium when available, but these were not always effective or safe. The physical toll on the mother was immense, with recovery being long and uncertain. The social support system was vital, as women often relied on the assistance of other community members for both the delivery and postpartum care. However, isolated living conditions on the frontier meant that such support was not always available, exacerbating the risks and difficulties of childbirth in the Old West. Number 8. Common diseases. Epidemics of diseases like cholera, smallpox, and dysentery devastated frontier communities in the Old West. These diseases spread rapidly due to poor sanitation and close living quarters. Cholera, transmitted through contaminated water, caused severe dehydration and death within hours. Treatment was minimal, often limited to oral rehydration with water and salt, but effective methods were not well understood. Smallpox, a viral infection, led to high fever, body aches, and a distinctive rash. Vaccination was available but not widespread on the frontier, leading to high mortality rates during outbreaks. Infected individuals were often isolated, but quarantine measures were rudimentary, with little understanding of how to effectively contain the virus. Dysentery, characterized by severe diarrhea and abdominal pain, was common due to poor hygiene and contaminated food and water. The lack of effective treatments and the high risk of dehydration made dysentery a major killer, particularly among children. Medical knowledge was limited, and treatments were largely based on trial and error rather than scientific evidence. For example, smallpox might be treated with poultices and herbal remedies, while cholera was often met with futile attempts to balance bodily humors. The high mortality rates from these diseases highlight the precariousness of life on the frontier and the significant gaps in medical knowledge and infrastructure. Public health measures were nearly non-existent, and the isolated nature of many frontier communities meant that diseases could decimate entire settlements before outside help could arrive. This environment created a perfect storm for the spread of infectious diseases, with limited resources and knowledge to combat them effectively.